Hey, it's Dr. Gregg, and I wanted to take a minute to just go through the amazing process we help patients go through, just to recap so that you can remember it after we've gone through the workshop. Now, for many people, when we meet them, they join us and they're in an inflamed state. They've got issues, they've got problems, and they've got symptoms. And on our chart here, you may look like our guy here or our girl here grabbing your neck or your lower back. Now, for many people, they don't, and we'll get to where you guys get started. But what happens at this point is that typically the spine is out of alignment, putting pressure on the nerves. We call that a subluxation. Those nerves don't know how to communicate, and they can't get the energy through to the tissues in the area or the organs or the muscles, and they start to break down. They weaken. They wind up not working right for you, and they give you symptoms. Here's where we get started and go right to work on moving the segment and taking pressure off the nerves so we can reduce the inflammation and let that energy flow through. During this first step, you're going to start to feel really better. Your inflammation is going to go down. You're going to start to see some mobility come back. Here in the office, we'll do some gentle adjustments into your spine. We'll do some therapies like electric stim, ice, and rollers. We may teach you some exercises and stretches to do at home. You'll also probably use an ice pack to reduce that inflammation. We may guide you to use some fish oils or some other anti-inflammatory protocols to help get you feeling better fast. During this phase, you may be here frequently, maybe 4 or 5 times a week, because we've got to get that inflammation down so we can start healing. Once we've gotten the bones barely off the nerves, you're going to feel a whole lot better. And as you start to feel better, we're going to start shifting some of the things that we do. And what we'll wind up doing is a test to see how much restoration of your curve we can wind up achieving and how much of the change has been permanently damaged. We call those correction potential images. We'll start to introduce some more active things for you to do, and it may be some exercises. We'll introduce some things for you to do at home, like walking, elliptical, bicycle, or swimming. We call this the subacute phase. You'll start to feel better. We're going to guide you to still ice, and you're going to get adjusted to take pressure off those nerves. We're also going to be determining where do we go. You'll join us for a workshop so we can see where we're going to go and how we're going to develop your health and what's going on into the future of health and how you got here. We'll also look to set out some health goals in the big picture, like 15, 20 years down the road, so that we can wind up taking care of this problem for good rather than continuing to have episodes, as you may have heard friends or other people have and described to you. Once we've figured out what kind of a correction take place, we're going to change and shift some of the things we do in the office. We're going to move you to a unique type of an exercise called a mirror image exercise. We're going to move you to a different kind of an adjustment called a mirror image adjustment. And we're going to use a tool called tractioning here in the office. That's a sustain hold to address one type of tissue that you'll learn about at the workshop. In this phase, we'll be moving the bones from barely off the nerves to making a correction take place. This is going to take time. It's going to take effort. It's going to take, first off, us teaching you how to do some of these things at home. Then it's going to take you doing them at home, and we're going to introduce some more advanced methods to push you harder and faster. We're going to look to update and check change about every 3 months to see how much of a correction has been achieved. Our goals are going to be to achieve 90% correction. So once we've achieved 90% correction, we'll work on stabilizing and strengthening. We're going to introduce you to lifestyle activities for you to do outside of here, whether it's going to the gym, exercise, working out, some strength training, so that we can build a great foundation, build around this great foundation of spinal support that we've developed, and you can continue to progress on your health. You'll get checked a little bit less frequently as you're introducing these activities. We call this the maintenance process. So you're out there working hard, and we're going to maintain your spine with regularity. Once we've stabilized and maintained for a period of time, usually about 6 months, we're going to look to shift you out to the world of wellness. You will have achieved spinal wellness, and you'll come in for your periodic checkups, just like you do with your dentist to get your teeth checked, where you'll be out there doing exercise and activity to develop your health and project and get to those health goals that you've set way back at the workshop, and we'll be there to maintain and guide you along the way. Now, this is a process. Your health is a process. And we're excited to have you as a part of it. And I'm excited to take you on this journey, to taking you from where you are to where you see life going, because taking care of your health is a lifelong journey. And the one place that I know that it needs to start is at the spine and the nervous system, because if the brain can't connect with the body, then the body doesn't know what to do. And all the exercise, all the nutrition, all the movement, All the supplements are going to do nothing if the body doesn't know how to do with it, what to do with it. Now, if you've liked this video, give it a thumbs up and share it. You also can wind up writing back to me if you have any questions about this. I love questions and always look to help. Once again, I'm Dr. Gregg Gerstin with the Lyme Wellness Center, and I'm looking forward to continuing with you along this path.